Welcome back. Dr. Cynthia Snider, Infection Prevention Medical Director at Cone Health, is here with us answering your COVID-19 related questions. Just today, the hospitals in our area announced that masks will be optional when it comes to tomorrow going to the hospital. So we have a couple of questions about masks. And the first one is, does the mask optional non-requirement apply to bedside nurses?
Yes, so the mask optional change is going to be across our whole system. It applies both to patients, visitors, and our staff. And again, remember, our staff is still required to check in to let us know if there's any symptoms that they're having. And again, some of the teammates will still be like their own choice to still continue to mask. So there's it's up to personal choice at this stage.
Right, it is optional, which means that some people will, of course, still be wearing those masks, and that's not a problem. All right, so this person said, I've had my booster, I work outside. Should I be wearing a mask?
I would say the risk of acquiring COVID outdoors is very minimal, so I don't think you necessarily need to wear a mask.
All right, but we did talk about wearing a mask inside, especially if you're traveling, like in a plane, that kind of thing. Most passengers that I've seen on planes are no longer wearing the masks. It's a very small amount. So this person's question is, how effective are masks if I'm the only person in a crowd that is masked?
So a well-fitting mask will be very protective. And even if you're the only one on the plane, which I've had come to be a couple times, and it's very protective. And ensuring, I would say, going on a plane, I would do like the KN95s or an N95 mask, right? Because this also has to do with like not only how many people in a crowded room or a crowded plane, also like how well the ventilation works.
Mm-hmm. This person says, I'm just getting over COVID and I was prescribed Paxlovid. It seemed extremely effective. What exactly does it do?
So Paxlovid is one of the antivirals that we have available to help not only decrease the kind of viral protection, the viral production that's happening, and it cuts down on symptoms and shedding. And what essentially does, it reduces your risk of having severe disease. And also there's new studies showing that it also prevents, it decreases the chances of long COVID probably by 25%.
Mm-hmm. Okay. And then this person says, how long should you wait after having COVID-19 to get a vaccine?
So you can have it as soon as you feel better from recovering from COVID illness, but you're likely to still have enough antibodies in your system for anywhere from up to 3 months. So it's that window of a couple weeks to 3 months.
Okay, great. Thank you so much for your time and your expertise. And again, masks optional starting tomorrow. If you missed any of our segments, you can head to the To Your Wellbeing section.